Good evening, Los Angeles. Today is day 613 of this pandemic, and this is the 98th time that you have welcomed me to your homes and your neighborhoods for an address about COVID-19. Each of these briefings is about you. It's about your families, it's about your neighborhoods, it's about your health, it's about your places of work, and it's about our city. But tonight I address you from a slightly different perspective, because as many of you know, I tested positive for COVID-19 almost 2 weeks ago representing this city in Glasgow, Scotland during the COP Climate Conference. It was a place where, as a side note, we delivered, including Los Angeles, 1,049 cities that committed themselves to addressing climate change, a group of cities as big as the fourth biggest emitter in this world, agreeing to zero out our emissions. So thank you to Los Angeles for leading and our fellow cities. But I returned from that climate conference home yesterday after 10 days of isolating in a hotel room, more than 5,000 miles from home, away from my family, away from my beloved city. And while I worked hard and stopped in Washington, D.C. to celebrate the passage of the historic bipartisan infrastructure package that Congress passed and President Biden signed, I was fortunate because in the days that I isolated, I had a mild fever for a day, some cold-like symptoms, lost my taste and smell for a few days, but then was fully recovered, probably thanks to the vaccine that I got earlier this year. The United Kingdom's experiencing a surge. They've often been ahead of our surges, and we can expect this to hit us here in the coming weeks and months. Since our last surge, when I last addressed you in July, the third biggest of this pandemic, today in LA County, the case numbers, the hospitalizations, and deaths are much better. But as the governor said, and any Game of Thrones fan knows, winter is coming. So we have to be prepared. We should know where we're at. And I want to acknowledge how tough and confusing this moment is. The colder temperatures and the increased time spent indoors just always make it easier for viruses, including COVID-19, to spread. Not only that, flu season, which experts say could be especially bad this year, is also bearing down on us at the same time. So tonight, let me talk to you as I always do, about the numbers, about what resources are available to you, and what you can do, actions you can take to make a difference for your fellow Angelenos. First, the numbers. They look very different this year, now that we have many people vaccinated. In fact, today we had 1,284 new infections in LA County, 467 here in LA City. Countywide, that's a 17% decrease from last week, which is encouraging. But still, let's remember, 5 times higher than the number of daily cases that were reported just on June 15th, when we lifted our strictest quarantine guidelines. Our 7-day positivity rate for testing is 0.9%. And to give you a little context, countywide, that climbed as high as 6.4% during the surge this summer. So we're in much better shape this moment. But we've seen an increase from just a couple weeks ago when it was less than half of that, at 0.4%. So this reflects a worrying trend that often are the early indicators of a surge that is coming. There are currently 616 people, beloved Angelenos, who are hospitalized across LA County, and 155 of them hanging on in intensive care units. When it comes to deaths, the 7-day average in the city of Los Angeles is 6, in the county 19. That's a 12% increase, worryingly, since last week. At the peak of our winter surge in January of this year, that number was at its highest, about 318 people a day. This tells us that a lot of folks have become vaccinated, have built up antibodies, and how effective our strategies have been. But we know that one death is too many, let alone nearly 20 a day still. Or to put it more starkly, in less than 3 weeks, we have more people dying in LA County from COVID than all the homicides we experience in the city in a single year. One of the ways we can get there is to continue to have those, I know, sometimes tough conversations, to understand people's fears, but to continue the great work we have done to have so many people protected and vaccinated here in LA County. The city has administered already 1.4 million doses to date directly, including 142,000 at our mobile sites for those who can't get to a doctor or to a clinic. And the rates of people over the age of 12 who have received at least one dose of the vaccine are very encouraging, 81.3% in the county, 77% here in the city. And as we head to the holidays, this is a good time to look at your family and your friends, to protect them, to extend your coverage, whether it's a first or a second shot or a booster shot. These are shields to help you and your loved ones stay safe and stay healthy. The fact is this: if you are unvaccinated, you are 44 times more likely than someone fully vaccinated to be hospitalized, and even worse, 60 times more likely to die. And those numbers still continue. Those who are dying in our hospitals are overwhelmingly the unvaccinated. And recent evidence showed that over 50% of people who contract COVID have long-lasting symptoms, more than 6 months. Not just loss of taste and smell, but forgetting things, not having brain functions, feeling pain. Let us all avoid those things for ourselves and our loved ones, whether it's vision problems, long-term memory issues. That's the why of the vaccine. So let me tell you the how. How can you continue to protect yourself? There are so many places now across LA County where you can get booster shots, your second shot, or your first. So go to coronavirus.lacity.org/getvaccinated, or if you want to look at the statewide website, myturn.ca.gov. It's easy, it's close, it's convenient, it's free. There's never been a better time, and there's plenty of supply. And the answer to who should get the vaccine is simple: everyone, especially those who are most at risk because of their age or a pre-existing health condition. As a parent, I know I and my wife were thrilled about the FDA's recent approval of vaccines for children 5 to 11, since our daughter Maya is in that age. And she was very excited and got her shot last week. Because while children have been less impacted by severe illness and hospitalization, it can happen, and while they're less likely, of course, to be hospitalized or die, they can be part of passing this on to vulnerable folks who are out there, including grandparents who they may be spending time with during the holidays. So on that note, I want to make something crystal clear again. This vaccine is free, and if you have family members who are coming for Thanksgiving or Christmas or the holidays, get them vaccinated. They can be from out of town, out of state, even out of the country. And we have the supplies here to make sure that your Thanksgiving table is safe, that while folks are around the Christmas tree, they are safe, and that all of us can continue to spread that safety in our families and our loved ones around the world. And I also want to clear up some confusion around boosters, because I know folks are wondering, am I eligible to get a booster? Let me say it simply. If you're 18 and older and want to get a booster, get it. I certainly was waiting for a Saturday that I wasn't working, and many of you will appreciate I don't really have Saturdays that I don't work, so I put it off, and I got COVID while I was in the United Kingdom. Do it, and do it now. Make sure, especially those of us that were vaccinated earlier in the year, like myself in January, have the protections, because all of the vaccines wear off over time. Their efficacy lowers each month. A booster can help bring you up to, for this winter surge, the highest level of protection for you and your family. And the FDA is expected this week to authorize the Pfizer booster for everyone over the age of 18, and the Centers for Disease Control is also set to weigh in that guidance. But we have the supply here in LA County. I've spoken with county officials. We want to speak clearly here in LA. If you're 18 or over, get the booster. And the booster shot will significantly increase the number of antibodies that are in your body. It'll make your shield stronger. In fact, a long-term study of the Pfizer vaccine shows that its ability to protect you against infection is about 88% in the first month, but after 5 months, it's down to 47%. And waning immunity is why we're seeing the breakthrough cases that I am a patient of, and that all of us now know friends and family that have gotten. Thankfully, those of us who have been vaccinated in the past have milder cases, are much less likely to be hospitalized. But we get boosters for all sorts of vaccines, for the flu each year and other things to increase their effectiveness. And this is no different. So I plan on getting my booster as soon as my doctor gives me the green light. He said right now I'm okay because of what I just went through. But as soon as I can, I will, and I encourage you to do the same. The city's testing partner, CORE, Community Organized Relief Effort, has been providing free testing services. So I want to also say, continue to know your status. I know a lot of us think we might just be getting a cold. Make sure it's not COVID-19, because it does spread so quickly and it can be so dangerous. So we still have hundreds of locations throughout the city and county where you can get a free COVID-19 test. And CORE is helping us out in the city at Union Station and the Edendale Library in Echo Park with no appointment or insurance needed, and at Thanksgiving Street Fair at the Midnight Mission on Thanksgiving Day. So to find a testing location near you, go again to coronavirus.lacity.org/testing. Or if you're not online, just call us at 833-540-0473 to schedule your test today. Looking ahead, there's an uncomfortable truth that I think we have to acknowledge. Until more of us in Los Angeles are fully vaccinated, we're at risk of living with this cycle forever. And I'm going to talk a little bit about that later, because so many people ask me, Mayor, when is this going to be over? We don't want to experience a relative lull in case numbers and hospitalizations and then get a surge and every few months be going back and forth. It's bad for our economy, it's bad for our psyche, it's bad for our health. We have to manage a balancing act, keeping each other safe while getting our economy back on track. And I have welcomed the good work that we have done here that has shown recently an analysis by Bloomberg Business Week that Los Angeles is leading the economic recovery. In fact, Los Angeles is the city with the highest additions of employment, the highest public valuations of our companies. We're beating every city in California, all the cities in Texas that always brag about stealing our business, New York, Chicago. LA really is performing well. But all of that is endangered when we see cases go up, when bars or restaurants have to put new restrictions or, God forbid, even close. That's why last month the city adopted an ordinance to require proof of a full COVID-19 vaccination in certain indoor settings that are most vulnerable to spread. These rules, known as Safe Pass LA, went into effect 1 week ago and cover what the County Department of Public Health identified as the most at high-risk locations. These are places where there are exceptions to the requirement that we wear masks indoors, like restaurants or other places where food is being served, places where people are exerting themselves physically, like indoor gyms and recreation centers, or where we come in close contact with folks, like nail salons and spas, tattoo shops for long periods of time, as well as those places where people are in close proximity for similarly long periods of times, like our movie theaters, concert venues, and museums. Safe Pass LA is also in effect at LA City buildings and facilities, and I'll note that we're working very hard with our city departments to ensure that we can implement that wherever people come and expect safe places, and we'll make sure that no one is denied city services and that accommodations can be made. So if you go to a large outdoor event, you'll need to show some proof of vaccination or a negative COVID-19 test taken within 72 hours of entry. In terms of the brass tacks of what Safe Pass LA means for you, it applies to everyone over the age of 12. You're considered fully vaccinated when it's been 2 weeks or more from your final dose of the 2-shot Pfizer or Moderna, or after your single shot Johnson & Johnson. And as what you need to provide proof, either your vaccination card, a photocopy or photo on your phone, a digital vaccine record, or documentation from your healthcare provider. This is a new step in our path out of the pandemic and to help protect our businesses. And I have to say it's working really well. When I've checked in with the county and as the county shared this week, our businesses are embracing this. I thank them for helping us with this. And so I hope soon it feels less like a burden and more like a blessing, something that opens up our freedoms and not restricts them. And I want to acknowledge our business owners who have really taken control of this, given us a lot of good advice on this, and who in some ways were out in front of us even before we did this as a city. In the first week of Safe Pass LA, health inspectors reported high rates of compliance by the businesses covered by the ordinance, so thank you for doing your part to help stop the spread. Be patient, I would remind people in this tough time. We are so divided as a society, sometimes by ideology, by party, and I just want to say as a mayor for all people in the city, remind us to be kind to each other, to be patient to each other, to listen to one another, to lead with strength, and to lead with love every single day. You can find out more information about Safe Pass LA, including a PDF of the notice that business owners can download and post at safepassla.org. And it's available already, not just in English, but in Spanish, Korean, and Armenian, and we're working on more languages soon. We're going to continue doing everything we can to protect you and your families, and to protect our city. But the toughest number for me always to share with you when we do these briefings are the number of our fellow souls that we've lost. And today that's 26,923. I know that's a tough number to wrap your head around. So picture Dodger Stadium full, and then remove half of those people, and that's how many people we have lost. Each and every one of those empty seats that you're picturing at Dodger Stadium, and for too many families, each and every one of those empty seats at our dinner table, is a story, is a life, and is a person. We lost loved ones. We lost workers who put their lives on the line for us, emergency responders, nurses, people who were stocking our shelves, people who were driving our buses. I shared those stories with you over the last year and a half. People like Rosary Castro Olega, 63, a beloved mother. She was a wife, a friend, and the first healthcare worker we lost here in Los Angeles to COVID. Rosary, we remember you. Jory Bohannon, 39 years old, who always had a smile for the passengers of the bus that he drove. Jory, we remember you. Ron Ziff, 83, a history buff, a dedicated member of his neighborhood council in Sherman Oaks. Ron, we remember you. And so many others, including 46 beloved City of LA workers that we lost. This has been such a difficult chapter for us, such a traumatic chapter for us. We have gone through more pain and suffering than we knew we had. But we also found more resilience and strength than we thought we could ever summon. And one thing that unites us all across any of the divisions we might feel day to day, it is this trauma, that are these memories, and it's not enough for us to simply share those numbers. We need to grieve together. We need to come together, and we need to embrace one another. That's what Strength and Love, the City of LA's COVID-19 Memorial this week, is all about, and what I want to share with you. This is in partnership with the Mayor's Fund for Los Angeles, a 3-day virtual and physical event that starts tomorrow and runs through Saturday, November 20th. There are activities every night at 8 p.m. You can share your photos and video of your loved ones on social media using the hashtag StrengthAndLoveLA. And tomorrow, to honor those who held our city together, join with your friends and neighbors and clap for LA's heroic first responders and frontline workers at 8 p.m. Let's make this city hear it in every single neighborhood. And on Friday, remember those we have lost to the pandemic and light a candle at 8 p.m. And on Saturday, to mobilize an even stronger and more resilient city, wave a flashlight or a phone light outside just to make LA shine at 8 p.m. on Saturday, just as we light up some of our most iconic buildings from here at City Hall to the Grand Park Fountain, SoFi Stadium, our airport, and so much more. And then you can carry that mobilization over to Sunday and close out the weekend by volunteering at a nonprofit just before Thanksgiving, or simply making a point of doing an act of kindness or donating to a group that needs it. If you visit Griffith Observatory, you'll see an incredible installation that was put there yesterday. There's 27,000 white flags, a sea of flags representing every human being, every beloved friend and neighbor that we have lost. I walked through the National Mall about a month ago to see a national sea of white flags that represented every American lost. I can't tell you how overwhelming it was. It moved me to tears as I thought through the names and the stories of the people I had talked to, the sons and daughters who no longer had a father or a mother, the grandparent who had left us too early, those frontline workers no longer with us. And so we wanted to do something similar here. And let me thank those volunteers. First, those folks from my staff who worked all day long squatting down and putting those, and then the people who came up and offered to chip in and spend a half hour or an hour placing more white flags. It's a way for us to say to those who are still grieving, we see you. We see you. And for those who we've lost, that we remember you, each and every one. Many tears were shed in the installation of these flags. And to see the scope of the loss that spreads out like that, to know that each flag is a person, is so powerful. In fact, one volunteer told us that she overheard a little boy say to his father, who was right there, "Dad, I'm so glad you're not a flag. Our hearts are with everybody who lost someone that they loved, who are represented by one of those 27,000 flags. And we can hold their memory now and always by summoning this spirit, by joining strength and love to commemorate what we've lost together. Because here's the thing, as big and spread out as our city is, as diverse as we are, we stood up for each other. We masked up to protect the most vulnerable among us. We knocked on doors to make sure people were fed. We donated our last dollars to make sure people even worse off than us had someplace to go. Let's take that spirit of compassion, that spirit of selflessness forward. And let's carry on with the Angelino spirit that kept us going and build on that momentum to build a stronger and a healthier and a more just city than ever. This holiday season, my fellow Angelinos, let us gather with those that we love the most. Let us hold them. Let us protect them. Let us have tough conversations with them to make sure we can continue to protect one another. And let's close our eyes and realize we are closer to the dream than ever. We can win this. This victory is here in front of us, but it requires each of us to take action, to do what's right, and to move this city forward. I'm grateful that we are so much safer today than a year ago, but I will truly celebrate when all of us are safe, when all of us can see this is a city that is open once again and protected in our hearts. Please join your fellow Angelinos for this 3-day memorial. And I know that there are so many folks as we enter this holiday season still struggling to make their ends meet. So I'll end tonight with a plea, as I often have, to help others. I know a lot of people think that was the toughest times of last year. But there are still too many people with empty fridges who are still calculating how to make the rent, pay their health insurance. And so Given, which is a partnership with the Mayor's Fund of Los Angeles and our Family Source Centers for our most vulnerable Angelinos, stands for Grocery Initiative for Vital Emergency Needs. Remember, this was the first thing we asked, just help for some groceries. We are launching again this year. This year, Given, our goal is to provide 5,000 families with $300 for food to help them celebrate these holidays as so many of us will. They'll get an Angelino Connect card, their debit cards with no fees, provide easy access to city services and support. And Angelinos have stepped up time and time again. So if you're able to, and you're listening to me tonight, please, let's help each other once again. Go to mayorsfundla.org, that's mayorsfundla.org, and give whatever you can tonight. We raise tens of millions of dollars from each other, for each other. And nothing to me embodied the spirit of this city more. I know we're exhausted. I know how confusing this moment still is. But I'll say it again, victory is at hand if we reach for it. If we want to defeat COVID, we can do this right now. A year ago, we didn't have vaccines. 6 months ago, we couldn't get boosters. A month ago, our youngest children couldn't be immunized. And even a few weeks ago, we didn't have some of the powerful therapeutics that can cut COVID suffering by as much as 85%. If we make a push, we don't have to live this way for the rest of our lives. And for those still wondering whether to take a brave step forward, I want to say we can do this. It's scary, I know. It's not always comfortable. And for those who have stepped outside their comfort zone to make sure they got that vaccination or did something by wearing a mask, thank you. Let's keep going to protect ourselves and extend that protection to our families, to our neighbors, and to our city. We're in such a far better place today than we were a year ago, and that's because of you. So thank you, Los Angeles, and as always, from my family to yours, strength and love. Thank you. With that, I will answer questions, and then I will speak in Spanish, as always. And thank you to our pool reporter who is here.
Hi, Julia Paskin with KPCC and LAist. Thanks so much for taking our questions.
Thank you, Julia.
Wondering if you can give us an update on the status of unvaccinated city employees and when will they start being forced to pay for their own testing?
Right. So the good news is overwhelmingly city employees have gotten vaccinated. The numbers are impressive and strong and getting better. And I want to be clear, the vaccine mandate is not about getting rid of employees. It's about, my goal is to keep every employee and to keep every employee safe. and to make sure their lives are safe. So we have 77 employees that are right now on unpaid leave. Within the next 2 weeks, approximately 700 are also vulnerable to be on paid leave. But in terms of the testing, we are planning to start employee testing this Friday. As you can appreciate, standing that up for hundreds of employees, even thousands potentially, twice a week was a little complex, so we gave employees and departments the more time that they needed to put that together. But that should be moving by this Friday.
And what is the plan to fill in for those vacancies, including for law enforcement?
You know, I've asked all department heads, including our chiefs of our fire department, police department, to ensure that we get as much coverage as possible. They put together plans. And I'm hopeful as these numbers continue to creep up, and they are quite strong already, that won't tax us, that we will be able to fulfill our city functions, that we'll be able to keep people safe, respond to our 911 calls. But they've both assured me that we can put that in place. It may cost us some money up front, but it's cost us a lot of money to lose people to COVID when they're out. That has cost us arguably even more.
Wondering if you can tell me about the efforts to vaccinate the unhoused community in LA.
Sure. So we continue. I don't have those numbers on me, but I'll get them to you. I know, have done a lot of work early on. It was one of the early successes that folks who were unhoused were actually less likely to have contracted COVID-19, and building on some of the street clinics that we did and some of the places that unhoused Angelenos go for their health care, we had very strong numbers. We're going to continue that. We're working with CORE and others to help folks that are unhoused get testing, but also to get access to vaccines. But let me get the latest numbers for you. I know about a month and a half ago, it was similar to the numbers of the population at large in terms of the percentage vaccinated in estimates.
Appreciate that. A follow-up question on vaccinations for city employees from Emily Alpert Reyes of the LA Times.
Yep.
She's wondering, why did the city require employee testing to be done through its own contractor rather than allowing unvaccinated employees to test at other sites?
Right. We wanted to make sure that everybody was getting tested and that we could trust the tests. So the personnel department put that out in a request for proposals. No elected officials were engaged in that process at all. They chose what they thought was the best on both price and capacity, and I think a vendor that also was doing that for the county, and the county had good experience with that too.
A question from Matthew Tinoco with the LA Podcast. What is the status of the investigation into alleged sexual harassment of Matthew Garza by Rick Jacobs, started in October 2020?
I believe the city attorney has done that, so that would be a question the city attorney's office would have to answer. I've made sure that I wanted to make sure there was no political oversight from this office of that, and that it was a truly independent investigation. But I understand they've completed it, they've talked to dozens of folks, and had a decent outcome on that. But that is not under my control. I haven't looked at it myself, and that would be directed to the city attorney.
Question from Marla Tejas from Fox 11.
Yes.
The sheriff and many LAFD firefighters warn the vaccine mandate is an imminent threat to public safety. That's a quote. For people concerned about law enforcement departments not having enough resources to keep them safe, what do you want them to know?
Well, thank you, Marla, for the question. And as I was just saying before, there's a threat both directions. If we continue to have people out because of COVID-19, we don't have the coverage for communities. It's been a huge cost that we just quantified as well, simply having folks that are still unvaccinated and get COVID-19, or who get breakthrough cases, that can cost as well. But it's predominantly folks who have been unvaccinated who have much deeper and much more severe cases. So there's a cost either way. We'd rather have some of the short-term costs up front, work with folks and encourage them to become vaccinated. Especially, I think we have a responsibility to the people we serve and those who are on the frontline communities, dealing with vulnerable populations, going into their homes, seniors, people with pre-existing health conditions, those who may have legitimate reasons why they are allergic to vaccines and other things. We can't be the carriers of what could be a death sentence to them. So I will never apologize for protecting our firefighters and our police officers from the #1 killer of police officers and firefighters in this country, nor the people that they serve. So there is a cost either way in both coverage and money, but if we didn't have this, let's be clear, we would continue to lose, as we have, firefighters, police officers who get sick and are out and aren't on our roster. And in a surge like what we expect this winter, that's really something that endangers our communities.
Question from John Peltz with Knock LA. LA Times reported that you met with Senator Ted Cruz. Any other meetings you can tell us about while you were in DC?
That was a few weeks ago, maybe even a couple months ago. All members of the Senate Foreign Relations Committee, the State Department reaches out to, and so I've met with many members, both Democratic and Republican, and had very good meetings with everybody. There is, I think, maybe 2 or 3 senators I haven't met with virtually or in person, but everybody else in the Senate Foreign Relations Committee I have, which is usual for me and every other nominee.
And a question from Danora Perez from Telemundo, and she's asking if you can provide your answers in Spanish.
Sure.
First, many are concerned about a winter surge. Are you, especially having had your own breakthrough case? And also, the city's vaccination mandate to enter inside certain businesses currently for kids 12 and older. Is there any possibility of that extending to younger children in the future?
Sure. I'll just say briefly in English and then in Spanish too. There may be plans by the county to extend that, and the city would certainly look at that guidance. But right now, I think it's comfortably at 12, and there's no plans to move that down right now, especially because it will take time. And parents are educating themselves, and I think parents deserve time. I looked at all the evidence. My wife and I, we were very comfortable going early, but I think we'll continue to see over the next few weeks and months. So I think it would be premature to even think about the 5 to 11-year-olds. The first half was on the, if you don't mind reminding me.
Concerned about a winter surge, especially after
yes.
having your own
And I think I've said that in English. Absolutely, I'm concerned. So en español, sí, es muy importante durante estos meses de invierno protegernos, porque históricamente durante estos meses es muy peligroso y hay más casos de COVID-19. Diré más de en mis palabras en español en un momento, pero este es el tiempo tradicionalmente más peligroso en el invierno. Y segundo, no hay planes ahora para reducir las edades de prohibición sin la vacuna para personas entre 5 y 11 años. Ahora solamente es por 12 años y más. Y estos son los planes ahora. Y necesitamos tener tiempo por las familias, por la educación de los padres y para proveer las vacunas por nuestros jóvenes entre 5 y 11 años. That's it? Okay.
That's it.
Thank you. All right. Well, I will move to Spanish. Thank you again, everybody. I wish everybody a very happy and safe Thanksgiving. Protect your families. Thank you for all you're doing. Help us reach out to others at mayorsfundla.org. And I look forward to seeing you all very soon. En español, ahora, muy buenas tardes a Los Ángeles. Me dirijo hacia ustedes hoy por la vez número 97, desde que comenzó esta pandemia de COVID-19. Como han escuchado, salí positivo con COVID-19 hace 2 semanas durante mi visita a Glasgow, Escocia, para la cumbre de cambio climático COP26. Acabo de regresar y supe que necesitaba dirigirme hacia ustedes. La última vez fue en julio, cuando estábamos enfrentando un aumento alarmante de casos de COVID-19. Y hoy los casos de contagio y hospitalización son mucho más bajos, pero empiezan a incrementar de nuevo. Todos podemos tomar pasos simples para evitar otro incremento. Recuerden usar sus mascarillas en espacios internos y lavarse las manos seguidamente. Y todos mayores de 18 años de edad que hayan recibido la vacuna hace 6 meses pueden y deben tomar la vacuna de refuerzo lo antes posible. Sabemos que la inmunidad se debilita con el tiempo, lo que incrementa la posibilidad de una infección como la que tuve yo. Y esto presenta un gran riesgo de enfermedad seria, hospitalización y hasta muerte. Estamos a 8 días del Día de Acción de Gracias y sé que es importante para familias y amistades el poder reunirse después de un largo y doloroso tiempo de separación. Podremos ver que se puede aproximar un incremento serio, pero esa no es la dirección que queremos tomar. Déjenme compartir unos datos recientes. Hoy hemos tenido 1,194 nuevos casos de infección en el condado de Los Ángeles y 467 en la ciudad de Los Ángeles. A lo largo del condado, una reducción de 16% desde la última semana. En la actualidad, hay 640 personas hospitalizadas con COVID-19 ahora en todo el condado de Los Ángeles y 162 pacientes en nuestras unidades de cuidado intensivos. Hoy hubo 35 nuevas muertes en el condado y 7 en la ciudad de Los Ángeles, un incremento de 40% desde la semana pasada. Como había mencionado, todos los mayores de 18 años de edad pueden y deben tomar la vacuna de refuerzo. La vacuna dará un incremento importante en la producción de anticuerpos en su sistema inmune. Hay muchos sitios en todo el condado de Los Ángeles donde pueden obtener la vacuna o la vacuna de refuerzo. Para encontrar un lugar cerca a usted, visite coronavirus.lacity.org/getvaccinated o myturn.ca.gov. Tenemos que vacunar a nuestros niños también. La aprobación de la vacuna para niños de edades de 5 a 11 por la FDA fue una gran noticia para muchas familias, para nuestra familia, incluyendo mía. Y animo a todos los niños mayores de 5 años a tomar ventaja de esta nueva guía. También quiero animar a cualquier persona que tenga síntomas a hacer la prueba. Se sabe su estatus. CORE, la organización asociada con la ciudad, ha estado proporcionando servicios gratuitos de pruebas a angelinos desde marzo de 2020. Y hay cientos de lugares en toda la ciudad y el condado donde usted puede obtener una prueba de COVID-19 gratis. No se necesita segura ni cita. Para encontrar un lugar cerca de usted y hacerse la prueba, visite coronavirus.lacity.org/testing o llámanos al 833-540-0473. Ahora, viendo hacia adelante, hasta que más de nosotros en Los Ángeles nos vacunemos. Estamos a riesgo de otro aumento en casos y necesitamos tomar las medidas necesarias para mantenernos seguros mientras recuperamos nuestra economía. Por lo tanto, la ciudad adoptó una nueva ordenanza el mes pasado que requiere comprobante la vacunación contra COVID-19 para poder acceder a ciertos lugares internos. Esta nueva medida, conocida como Safe Pass LA, tomó efecto la semana pasada y cubre los siguientes sitios: restaurantes, gimnasios, centros de recreación, lugares donde están cerca otros como spas, salones de estética y estudios de tatuaje, cines, sedes de conciertos y museos. También tendrán que mostrar comprobante de vacunación o prueba negativa de COVID-19 tomada por los menos 72 horas antes de asistir a un evento grande al aire libre. Esto es lo que Safe Pass LA significa para usted. Safe Pass LA aplica a todos los mayores de 12 años de edad. Y usted está considerado completamente vacunado cuando tenga sus 2 dosis de la vacuna Pfizer o Moderna o una dosis de la vacuna Johnson & Johnson. Como comprobante puede presentar una tarjeta de vacunación en fotocopia o foto en su teléfono, un comprobante digital o documento de su médico. Para los negocios, esto se trata de mantener a sus trabajadores y clientes seguros y asegurarnos que estemos en control de este virus para no volver a tomar medidas drásticas y difíciles como las del año pasado. Para más información, visite safepassla.org. Este ha sido un capítulo sumamente difícil para todos como individuos y como una ciudad. Ahora, para reflejar sobre nuestra experiencia colectiva, estaremos rindiendo homenaje a través de un monumento conmemorativo de COVID-19 llamado Fuerza y Amor esta semana. Un esfuerzo en asociación con el Fondo de la Alcaldía de Los Ángeles. Y este tributo virtual de 3 días empieza mañana y dura hasta el sábado 20 de noviembre. Habrá actividades cada noche, empezando a las 8 p.m. Puede compartir, 8 en la tarde. Puede compartir sus fotos y videos en las redes sociales usando hashtag StrengthAndLoveLA. Si visita el Observatorio Griffith durante este fin de semana, podrá ver una increíble instalación de casi 27,000 banderas, un mar de banderas puestas por los voluntarios que representan a cada persona que ha fallecido por COVID. Para aprender cómo participar, por favor, visite lamayor.org/COVID Memorial. Estamos en un lugar mucho mejor del que estábamos en el año pasado. Y esto es gracias a todos de ustedes, por cómo se han continuado cuidando, el uno a otro, y por hacer todo lo posible para detener la propagación del virus. Gracias a toda la gente de Los Ángeles, gracias al espíritu de esta ciudad de Los Ángeles, y como siempre, de mi familia a su familia, fuerza y amor, Los Ángeles. Muy buenas noches.